Hello. So, part of what we've done at the Global Health Research Group in Surgical Technologies is train surgeons in Northeast India to do keyhole surgery. So, using keyhole surgery, surgeons can perform an operation on you through a tiny hole about this big. But to see what they're doing inside the body, they have to look through a camera and perform the operation. Do you think that you can do that? Let's find out.
Here's the equipment you'll need. It has been specially designed so you can try keyhole surgery at home. In remote hospitals in Northeast India, they use very different equipment, but it's also specially designed so they can do keyhole surgery there. The cardboard box is your pretend patient. Cut off one end so that you can see inside. In real life, a surgeon has a tiny camera, so only needs to make a small cut to see inside the patient. The egg boxes are to hold your sweets. The aim is to move sweets from one to the other. You can use anything you like that will hold your sweets. If you have polos, you could make a pole to loop them round. Now set up the mirror or front camera of a phone, laptop or tablet in front of the open end of your box. If you sit at the other end, you should be able to see inside the box through the reflection. Make 2 small holes near the egg boxes. These are like the cuts the surgeon makes to get their tools inside the body to fix the patient. Remember, smaller cuts heal faster. Insert your surgical tools and perform the operation. Try and move sweets from one egg box to the other, using the reflection to see what you're doing.